Hi, this video is the art of hair transplant restoration surgery on a client who has a frontal hair loss even toward the mid-scalp and a little bit in the back. And so we're gonna do at least 3,500 grafts around in the front half, so around 2,500 to 3,000, and then the rest 1,000 we're gonna fill in the back half. Because the back half he has quite a bit of hair, so we didn't need to go like 5,000 grafts or any of that stuff. So 3,500 is a good starting number for him. As you know, hair transplant surgical skill is one thing, and that surgical skill will determine the density and predict the density. And it's very important because that's how you want to harvest healthy graft, you want to dissect create healthy graft, and put the environment with a nice, what they call a healthy environment where the hair grafts stay healthy, so when we transplant it's still healthy. And then that's determine how dense the hair graft is. The artistic and aesthetic detail will determine how natural hair line should be. I mean, in the old days, most doctors would say you should be happy you just have hair. But nowadays, having hair is not good enough. Having hair that's natural for you, that you walk down the street as if you were born with this type of hairline, and as if no one have touched your hair. And that's the goal that we always strive. And when I create the hairline, I always create a very natural and unique hairline for each individual facial structure. Why? Because we build the hairline according to your facial structure. As long as a third, from the mid eyebrow to the hairline is a third, from the mid glabella to the tip of the nose a third, tip of the nose and bottom chin's a third. And then depend how wide your face is. The more narrow the face, the more arch back the hairline. The more round the face, the more flat the hairline is. And this client, he actually brought his photo when he was younger, and quite a bit. So that kind of gave me a clue. Now, with or without past photo, I can still create a very natural hairline. But with your old past hair photo, it's helped. Why? Because you want it to bring back where the hairline should be. Now, it doesn't necessarily have to be a baby hairline when you were 18 or 20, but you want to create the hairline that's natural for your face and still the mature hairline. I understand the idea of mature hairline, but I noticed some clinic that did a mature hairline like half of the head. Still, yeah, you have hair, but then you have big giant forehead. It's not natural that way. So once we get the shape down, we zigzag. As I mentioned, there's two types of zigzag. There's a soft hairline and a tight hairline. The soft hairline will have a bigger zigzag, and we'll use a bit more amounts of root that goes single hair, so to make the hairline look soft and natural. However, the downside is because we use a lot more single hair graft to have it soft, it looks a little bit thinner. It doesn't look as sharp and dense. Versus the tight hairline is a smaller hairline with smaller zigzag. Not smaller hairline, smaller zigzag. So then we use less amount of root to grow single hair. And more of the celebrity use this type of hairline. Why? Because they want to bring a wow factor. They want to have a very sharp hairline. It doesn't mean you're going to have a natural hairline, because we're not going to do a straight line. But some people, can go that one extreme to another, or go in between. You don't have to have a tight hairline. But if you are after a very nice dense look, then tight hairline is the way to go. If you want a very natural look and with not much detectability and still have a slight bald look, then or kind of slight thinning look, soft hairline might be the way. But majority of people stay somewhere in the middle, and just convey that to me during the surgery day. Once we get the idea down, the shape and the type of hairline, we transplant a very precise angle of 35-45 in the front, increase when you go backward, and changes when you go different direction. With that said, we still tend to follow his natural pattern of hairline. I mean, his natural pattern of his hair angle. And I will be precisely create the angle myself. And then once we get talk about precise angle, the selection hair graft is important. We transplant rows and rows single hair graft in the front, followed by root to go 2 hair, 3 hair, and 4 hair in the back for bulk and volume. As you know, I'm focused not only the density, but I focus heavily on the artistry of the hairline, because that really dictates how natural the hairline is and how natural your look is. And that's really trying to separate from different clinic. for more information, you can go to my website at www.mhtaclinic.com or call 1-866-999-6482 or 408-356-8600, or just go to your YouTube channel and just do the FUE or just hair transplant before and after by Dr. Diep. Thank you.